This morning to talk about all the big health-related topics. Good to see you again, sir.
Yeah, likewise.
Do the fist pump to keep things hygienic. Still, once again, talking about the flu. I know we said it could be the worst season in 15, 16 years, but we've seen some new statistics, too, just showing just how widespread this is, especially so late in the season.
It is, Tim. We're still seeing a very high degree of flu nationwide, coast to coast. And things that folks need to keep in mind always is get the flu shot. And make sure that you practice basic hygiene that will prevent flu transmission. Yeah. What does that mean? So wearing a mask if you're in an indoor crowded situation. Everybody should assess, what their medical conditions are. Do they live with someone who's more medically vulnerable to getting influenza, COVID-19, RSV, and some severe complications from those viruses? Because then you need to take some extra measures to keep everyone safe. Wash your hands with soap and water, use a hand sanitizer, disinfect surfaces, and if you are sick, stay home. And if you're sick where you have a persistent fever, shortness of breath, other red flags, seek medical attention. You may get tested for either influenza, COVID-19, RSV, because there's treatment options available depending on whether you test positive for one of these viruses.
Are there any other special things you can do if your kid is the one who's sick? Because we're seeing a lot of kids getting the flu this year compared to years past.
And one of the reasons is the lower vaccination in children that we're seeing. It's the lowest in 6 years for influenza. But it's the same basic precautions that I just mentioned that we need to double down on, Tim.
Yes. Now, well, talking about vaccination and vaccination rates lagging, here we go. A fast-moving measles outbreak in northern Texas widened this week. Now, 58 cases over the past 3 weeks, and it looks like maybe vaccine exemptions might be behind that.
Yeah, so this is centered in northwest Texas, in a place called Gaines County. There's also new cases that we are seeing in New Mexico, just right outside Gaines County on the other side of the state border. It's concentrated in a very small, close-knit community where vaccination rates, to your point, have lagged for measles.
Yeah.
And we've seen, we've regressed, unfortunately, as a country since 2000 when we were declared measles-free, where we now have seen outbreaks periodically pop up in parts of the country, especially in areas where there's lower vaccination rates. So just to remind folks, there are two shots to this vaccination, MMR, measles, mumps, and rubella. 12 to 15 months of age, first shot, and then when your child is 4 to 5 years of age. Most children, they will recover from measles, Tim, but in some folks, there may be some severe complications, whether it's pneumonia, blindness, brain swelling, and even death.
Yeah, and given how incredibly contagious measles is, just even a small drop in vaccination rates is what allows this thing to proliferate and spread.
9 out of 10 people who are susceptible to getting this virus because they're not vaccinated will get infected.
Just from an exposure of a given amount of time. 9 out of 10. That is amazing. All right. While we have a little bit more time, just want to talk about the health of the Pope. Now we're hearing double pneumonia in both lungs. But there was a term that I think doctors at the Vatican and Gemelli Hospital there were using that I hadn't heard before. A polymicrobial infection, possibly? What is that?
Basically, this means, Tim, that there might be bacteria, viruses, fungi, and even parasites involved. Usually it's bacteria, viruses that may be involved in an infection. So it's multiple pathogens, which basically means treatment will need to be tailored towards all of them. So there might be more than one medication being used to combat this infection. And we see it in older individuals. Those that may have more complex health issues or underlying medical problems are more susceptible to such infections.
Okay, of course, we wish the Pope well. Thank you so much for taking the time to join us, Dr. Wait. Let's see, this is what we're doing. I'm pretty sure whatever the flu was, I had it and it's gone, but yeah, you can never be too safe. Thank you, Dr. Hussain.
Thank you.